Understanding Sarcoidosis, a comprehensive review of symptoms, diagnosis, and management. Hey everyone, welcome back to the channel. Today we're breaking down one of the most fascinating and sometimes confusing autoimmune conditions, sarcoidosis. Whether you're a healthcare student, provider, or someone recently diagnosed, this video will walk you through what sarcoidosis is, how it presents, how we diagnose it, and most importantly, when to treat it and when not to. Let's get started. Sarcoidosis is a multi-system inflammatory disease marked by the formation of non-caseating granulomas. These are tight clusters of immune cells that can affect nearly any organ. The exact cause is unknown, but likely involves a genetically predisposed immune system reacting to an environmental or infectious trigger. It primarily affects adults aged 20 to 40, with a higher prevalence in African American and Scandinavian populations. The lungs are affected in about 90% of cases, often causing dry cough, dyspnea, and chest discomfort. The skin can show signs like erythema nodosum or lupus pernio. Eyes may develop uveitis, blurry vision, or photophobia. Cardiac involvement can lead to arrhythmias, heart block, or cardiomyopathy. The liver and spleen may enlarge, and lab tests may show abnormal liver enzymes. Neurologic symptoms can include cranial nerve palsies, seizures, or encephalopathy. Common systemic symptoms include fatigue, low-grade fever, night sweats, and weight loss. Two special syndromes include Lufgren's, featuring erythema nodosum, bilateral hilar lymphadenopathy, and ankle arthritis, and Herefort's with uveitis, parotid swelling, fever, and facial nerve palsy. For diagnosis, start with a chest X-ray to look for bilateral hilar adenopathy. CT can provide better detail. Lab findings may include elevated ACE levels, hypercalcemia, and abnormal liver function tests. Pulmonary function tests often show a restrictive pattern with low DLCO. A biopsy is required for confirmation, showing non-caseating granulomas. It's critical to rule out mimics like tuberculosis, fungal infections, or lymphoma. PET-CT scans are useful for detecting inflammation or extrapulmonary disease. Choose biopsy sites based on accessibility, such as lung, lymph node, conjunctiva, or skin lesions. When to observe versus treat depends on symptoms and organ involvement. Mild or asymptomatic cases, stage 1 pulmonary disease and Lufgren syndrome, often don't need immediate treatment. Instead, monitor with repeat imaging every 3 to 6 months, track symptoms and PFTs, and check labs periodically. Start corticosteroids if there is symptomatic or progressive lung disease, worsening PFTs, or organ involvement. This includes the eyes, heart, nervous system, kidneys, or disfiguring skin lesions. Constitutional symptoms like persistent fevers, weight loss, or disabling fatigue also warrant treatment. Start prednisone 20 to 40 milligrams daily, tapering slowly over 6 to 12 months. Relapses are common with rapid taper, so go slow. For chronic or refractory disease, consider steroid-sparing agents like methotrexate, azathioprine, or leflunomide. Hydroxychloroquine is helpful for skin or calcium-related issues. TNF inhibitors such as infliximab are reserved for severe neurosarcoidosis or cardiac cases. Most stage 1 or Lufgren's cases remit spontaneously. However, chronic sarcoidosis can lead to lung or heart fibrosis. Monitor long-term with serial imaging, pulmonary tests, eye exams, and heart monitoring if needed. Adjust based on which organs are involved. To recap, sarcoidosis is a granulomatous inflammatory disease of unclear origin. It most commonly affects the lungs but can involve nearly any organ. Diagnosis relies on imaging, labs, and biopsy confirmation. Many cases don't need treatment. Treat when symptoms are severe or vital organs are at risk. The long-term prognosis is generally good with regular monitoring. Thanks for tuning in. Sarcoidosis can be unpredictable, but with the right tools and awareness, it's absolutely manageable. If you found this helpful, don't forget to like, subscribe, and drop a comment below. And as always, stay curious, stay informed, and stay well.